Welcome to Maplewood High School, home of the Mighty Panthers, where we take pride in providing an exemplary college and career-ready learning environment to prepare today's students for tomorrow's opportunities. It is with great pleasure to hold the first town hall meeting for the Honorable Mayor David Browley. Before we begin, we have water in the hallway outside the auditorium. There are bathrooms directly behind the stage. There's also bathrooms to the left main hallway at the main entrance. We have student ambassadors that will escort you if you need to get to the bathrooms. If you wish to ask a question or comment during the meeting, please stand and come to the end of the row where you're sitting, and someone with a microphone will come to you. Before you speak, we ask that you state your name and your neighborhood. Mayor David Browley is the 8th mayor of the Metropolitan Government of Nashville and Davidson County. He was elected vice mayor on September the 10th, 2015, and was sworn in as mayor on March the 6th, 2018. He is a native Nashvilleian and attended Glendale Elementary School, Lipscomb Middle School, and Montgomery Bell Academy. He earned a bachelor's degree from Georgetown University. After college, he lived in Latin America, where he volunteered as a teacher and became fluent in Spanish. He completed his Juris Doctorate at Golden Gate University in San Francisco and received honors for administrative and environmental law, practicing as an attorney prior to becoming mayor. Mayor Browley was elected to serve as an at-large Metro Council member for Davidson County from 1999 to 2007. He was the vice chair of the Budget and Finance Committee and held seats on the Personnel, Public Information, Human Relations and Housing Committee, the Traffic and Parking Committee, and the Greenways Committee. Mayor Browley is married to Mrs. Jody Bell Browley, who is also a member of the bar practicing criminal law defense. They have one son by the name of Sam. Last but most certainly not least, Mayor Browley is the grandson of Beverly Browley, the first mayor of Metropolitan Government of Nashville and Davidson County. Without further ado, please help me in welcoming our mayor, David Browley.
Typical. Got to move it down a little bit. Thank you, Dr. Mason. Thanks, y'all. Thank everybody for being here tonight, and good evening. I used to take Ellington Parkway home every night and get off at the Broadmoor exit to go home. I've moved downtown, so I'm glad to be back in my old neighborhood. So 43 days ago today, I was sworn in as mayor. And that night, I announced to the city that I would be leading a series of town halls around the community, and that was because I felt that, number one, it's an important part of leading the city to step forward and hear from people who live in this town, hear their criticisms, their questions, and maybe occasionally a little bit of praise for the government. And it's especially been an unusual time here in the last few weeks in our town. So with I guess some extraordinary circumstances, so I thought it was especially important to do it right now. And then this is how government works best in my mind, where people get a chance to speak freely to their elected officials and call upon them to do what's right for the community. So we'll be doing this one tonight. We have 5 more scheduled, and then 3 more after the, I guess in a few weeks. I don't know exactly when, but we're scheduling those. So recently, I'm going to say a little bit, then we'll jump into questions. Recently, I guess in the last few months, the city has conducted a resident survey for the very first time. It was community-wide. It's something we'd never done before, but it was an important part of understanding how the citizens of Nashville see their government. It was important not just for its own sake, but because it's going to inform us in determining how we make decisions in terms of allocation of resources and our priorities going forward. That's another big part of why we're here tonight, to let you know a little bit about what those results were. So there was overwhelmingly more good news in the survey than there was bad. It showed, for example, 80% of Nashvillians feel very positively about Nashville as a place to live. 77% feel it's a good place to work. 66% feel positively about the quality of life in Nashville. And 59% are satisfied with the services being provided by the city. And that's not too much of a surprise. It shouldn't be a surprise to anybody because in many respects, by virtually every measure, we're doing pretty well. We have unprecedented unemployment. The economy is growing faster than it ever has. But nevertheless, it's creating some issues, and we know what they are. If you looked at the survey, there were some things that were clearly, I think, to be anticipated in terms of things that scored a little bit lower, and I'll get to those in a minute. Some things that we're already doing to make it easier for the people of Nashville to interact with the government, one of which is a thing called Hub Nashville. Who, other than the Metro employees, how many people here have heard of Hub Nashville? Okay, so some. It's our new, I guess, comprehensive customer service rollout, let's call it. It's a system where citizens can go to one place and register a complaint, a concern, want something to change in the city, and you can keep track of it, and the city can hopefully quickly address it. It went live last summer, and we've had 60,000 or almost 60,000 requests so far that have been received and processed. It's an efficient way for the city to, for people in the city to access services that are being provided by the government. If you're not so much on going on the internet to do it, you can call 311, and from 7 a.m. to 5 p.m. Monday through Friday, we have 10 members of Hub Nashville Contact Center that are there to answer your questions. Or if you're more interested in getting your phone out, you can go to hub.nashville.gov and do it through that manner. And in the next few days, we're going to be rolling out an app as well, and Hub Nashville app, which is something I think we've all thought about. Why can't I go on my phone, take a picture of whatever the problem is, and send it to the government so they will take action on it? All of this is complemented by a program called NashView, which lets you go on a map of Nashville and access information based on the location in the map related to all kinds of Metro services and the open data that's available. I want to make sure that I don't stop talking or don't start answering questions before without talking about transit. I think you already know that we have a ballot initiative that early voting ends next Thursday. That is 1 week from today, and then we actually have an election on May 1st. I'm a supporter of the transit initiative, and for a whole lot of reasons, but the resident survey really backed that up. When we asked people what we needed to focus on most, 2 things came up clearly at the top. One was the maintenance of streets, sidewalks, and our infrastructure, and the second was the improvement of public transportation. So I think we all know that we need to do something to address the growing population in our town and our growing inability to get around conveniently. I support the initiative on May 1st because I think it's a good plan. I think it is not asking too much financially from the people in Davidson County, and it's designed in such a way that commuters will pay a significant part of the burden of doing it. So if we don't do something, this problem is not magically going to disappear. We're going to continue to have to work and find a way to improve the ability of the people in Davidson County to get around. If you want to get more information about it, I think there's a transit table in the back. And additionally, you can go to letsmovenashville.com and get more information there. One last thing before I move on to answering questions and accepting all the praise that is going to come to me and the government. I do want to recognize that we do have at least 5 elected officials here in the audience with us. Council Lady Erica Gilmore, Council Lady Sharon Hurt, Council Lady Nancy Van Rees, Council Lady Brenda Haywood, and I think Councilman Brett Withers is here too. I think I was told he's here. If he is not here, he was here and he is now he just left. He had to go to Inglewood. So additionally, we have a very long list of department heads and Metro employees who are here tonight. I'm not gonna take the time necessary to read all their names, but I do want to say thank you all for coming tonight. I do appreciate it. And so one more thank you. I do especially want to thank Keely Jones Mason, Dr. Mason. I don't know where she went. She's the one who, yeah, thank you very much. I want to thank her and Dr. Sean Joseph at Metro Public Schools for putting the extra effort in to make this available to us tonight. I know there's plenty going on this week. I think standardized testing is taking place this week, and Dr. Joseph is working on the budget, and so I do thank everything. I thank you for all the effort that y'all put in tonight to make this a possibility. Before we jump into questions, one admonition, I guess I would say. The admonition is that we want to hear from as many people as possible, so we're going to have people walking around with the microphones. If they start to pull it away from you, please know that they did that because we're just trying to get as many people in as possible. And I know everybody's going to have I'm a lawyer by trade, so I know I always prefaced every question with a long 5-minute lead-in. I encourage you not to do that and try and get to the question. I do think I saw Representative Harold Love walk in the back. Did I see that? I did not. Okay, the lights are too bright on me there, so, all right. Anyway, with that in mind, are there any questions? Okay, seeing none. Thank you all for coming. I'll be glad to come back tomorrow. I'm probably going to walk around. Did you hear?
Good evening. My name is David Harris. I happen to be a candidate for executive commitment in District 3. But my question is the process for sidewalks from Brick Church Pike. I noticed they put this really fancy cutout for transportation for Republic High School, which is very much necessary. But there are a lot of people that walk that path trying to get to the transit lines, and it's not only do we need sidewalks, but lights, because it is pitch black out there in the morning, and trying to get from, say, Bellshire Street to come on back to catch a bus, it is a disaster in the morning. As a matter of fact, there are a lot of the young ladies that are coming trying to catch a bus to get here, trying to catch a bus to get to Pearl Cone, trying to catch a bus to get to several schools. And like I said, I just noticed they did a fantastic job right there by Republic, but there are hundreds of citizens that need sidewalks and lighting down Brick Church Pike.
I agree. Is that in your district? Is that part of the USD or the GSD? Okay. So we have the General Services District and the Urban Services District. In the General Services District, which it sounds like this is, the tax rate is a slight bit lower. So as a result, we don't put streetlights in the General Services District, not quite at quite the same amount. So that's probably why there's not as many streetlights in that particular area as there could be. But I agree with you that a fundamental obligation of the city is to make sure that each and every person who lives here has the capacity to move around town and to get from point A to point B in a safe and convenient way. That's one of the reasons I support this transit initiative, because I think it is really the most clear way for us to go out and make the kind of investments so that people can get around. I'm going to come to schools just for a second and say that over the last decades we have focused in Nashville on making sure, on providing choice, right? Children should be able to, and their families should be able to pick the school that they want to go to. Well, if they can't walk to a bus stop, or if the buses aren't frequent enough for them to get to them, then it is really going to be problematic for that family to get to the best choice for their child. So we've got to do a better job of adding sidewalks that connect to schools primarily. That is like always priority number one in terms of how we invest in sidewalks. Unfortunately, as a community, we have built out over decades and let developers come in and build houses and subdivisions without requiring sidewalks to be built as we did it. So we've got decades of catch-up work to do. We're investing every year in the sidewalk fund to make sure that we are building more sidewalks, but we've got a long way to go. And I can tell you, I mean, that's why we did the survey. So that what we've been thinking, we wanted to have verification from the public that we were right. That's why that infrastructure, sidewalks, transportation was number one in terms of what we needed to focus on. I know I've seen we've been joined by Councilman Jim Schulman as well. So I'll just thank you for coming, Mr. Schulman.
Hi, my name is Alicia Buffer, and I would like to know, what are your plans, goals, and commitments to General Hospital?
Okay. So I don't know, I guess it goes back to Thanksgiving of last year. I had conversations with the mayor just to make sure that she understood, that Mayor Berry at the time, that I felt we needed to make a commitment to keeping the inpatient services open at General Hospital. And I remain steadfast in that commitment to make sure that it is open. I see that Joe Webb is here tonight, I think it's CEO of, is that the title? CEO, all the titles, I get the titles wrong. The CEO of General Hospital. Dr. Webb and I met Monday, to talk about that commitment and to see what I could do to help make sure that the hospital is run in the most efficient way and providing the kind of services that the community needs. So I'm working hard as much as I can to be an asset in preserving the hospital and making sure that it remains as an important resource in the community. So.
Thank you. My name is Lindsay Mihalchik. I'm in East Nashville, and I was just wondering if your office had any plans for any initiatives to combat the youth violence in Nashville?
Well, yes and no. I mean, I wish I knew exactly what the right answer to that was about what to do. And I guess I could stand up here and pretend like I knew exactly what to do on that, but I'm not going to do that. It's a deeply troubling set of circumstances, and it is something that is that we have people across government trying to work on and figure out what to do. So it's been important to me since I was sworn in. The first day I met with the staff, we talked about my getting out to Metro Public Schools. So I, within a couple of weeks, was at Pearl Cone, which is one of the schools in Nashville that has, not exclusively, but one of the schools that's seen more teen violence, youth violence than most. And so there is a lot of great stuff going on at Pearl Cone, right? I mean, there are kids that are coming out of Pearl Cone that are ready to go to college and they're going to be successful. It's not uniform, but there's a lot of good stuff going on there. At the same time as I was walking out, the principal there, who's been there 6 years, this was not long after the Parkland, Florida shooting, she pointed out to me that in Parkland, Florida, 17 children died in one day in a shooting, and the entire country was outraged and stood up, and children marched, and young people got engaged. In the 6 years she'd been there, she'd lost 17 children too, to gun violence in her school. And there hadn't been the same level of outrage or action, frankly. And so I think it's important to acknowledge that these days of gun violence where it's just totally out of control and it's traumatic and everybody gets outraged, we have a slow motion trauma of equal importance that's taking place in a lot of our schools. I think it's critical for the mayor of this town to say it's happening way too much in the African American community too. I mean, there's way too much of it going on there. So this week I met with a group of grassroots community organizations that are working with youth in these affected communities every day, and I made a commitment to them to do everything I can to find resources to make sure that they can go out and intervene face to face on a grassroots level with people in the community who need our help and who need our focus. Beyond that, if it were up to me, and I think if it were up to the Metro Council, we would do some stuff to regulate guns in our town. But we can't. The state won't let us. We have no capacity to do anything legally to regulate guns. So all I can do in that respect is look to each and every one of the people in every room I ever get to and say, if you have a gun in your car, don't leave it there anymore. Because kids are getting guns from cars a lot. That's why there's so many broken into. They'll break into a car and get a gun. So don't leave your gun in a car, please. The second thing that we're working on, I can't tell a single gun seller in town to do anything. I can't do that, but I'm going to ask them. I'm going to ask some of the people selling guns in our town to stop doing what they're doing, because some of the things that get sold in gun shops are just not, we don't need to have them sold in our town. So then finally, the last long answer to your question, the final thing I'll say, and this is something that Judge Sheila Calloway has taught me, is a significant problem that we have as a community in terms of trying to confront this issue is that for too long we have looked at children making these horrible decisions and looked at them and said, well, what's wrong with this young person? And instead we need to take a step back, I think, and start thinking about what has happened to the children. And so, for example, it's very clear that you can look at adverse childhood events, and if you go down the list and you check off enough boxes, the likelihood of that child having ending up off the path is very high. So if we know that a child is that they have a family member who's struggling with drug and alcohol abuse or mental illness or without a job, there's a whole list of things that we know lead to these acts of violence. So we've got to, I think, broaden our approach and start looking more holistically at the circumstances that lead to these instances to try and shortcut them at the beginning. So that's how I feel about it. I don't know all the right answers there. I know what we need to what the approach needs to be, in my opinion, but we've got work to do to sort of build out all of the elements of implementing what I just talked about.
My name is Ruth Baggett. I live in the Cleveland area. My question is, you stated earlier that you now live downtown, so I'm sure you're aware of the amount of homelessness that we have. The last count I heard was that there are over 4,000 homeless people in the downtown area. We tend to think of these mostly as men that are just don't want to work and just out begging, but a number of these are women, youth, and children. What is Metro's plan for getting some assistance with housing availability? A lot of these people are approved for Section 8 housing or for housing, but there is not any available. So what can Metro do to help change this so we can get people off the street and into a stable environment, especially when it comes to the women and children?
Thank you. That's I think a critical question and something we importantly have to be focused on. So we have a affordable housing issue across the board, right? It is, it's not just for homeless, and I'll come back to the homeless. It's also for people who work for a living. So when I grew up here in Nashville in the 60s and 70s, everybody was in the workforce, right? That's all we had was workforce housing because it was inexpensive to live here. That's not the case anymore. So we've got, and that at the top, making it more expensive for people who are working for a living makes it what it does is it makes it more expensive for everybody. So I'm going to talk in jargon a little bit, and I apologize for that. There's sort of three types of housing that we need to be focused on. The first is the very affordable housing for people who are making 0 to 60% of the area's median income. And that includes people who are homeless primarily. You're going to see that's primarily that group of people. The only way for us to make a significant dent in that group is for the government to put resources towards it, for us to spend money. We're never going to convince a developer to tweak their development to add 100 units of housing that's going to accommodate somebody who makes 0 to 60% of median income. It's not going to happen. So on that front, we're working very hard to announce in the coming days, I guess it is now, and I hope we'll be able to announce a project that will result in the addition of 100 plus units of permanent housing for the homeless. I'm probably not supposed to say that because if it doesn't happen, then people are going to ask me why, but we're working very hard to announce that. If this project doesn't work, we'll find another project because the city is going to start building some housing for the homeless because that's really the only way to make that happen. We got to do it. And I'm committed to making sure we do it in the short term. That next area, the 60 to 120% of median income, we can affect that to a certain degree with what we're doing through the Barnes Fund. So every year we put about $10 million into a fund. We partner with primarily not-for-profit agencies here in town, and they leverage their resources and land that we give them as well, and we're adding units gradually in that area. And that is, I think, Adrian, I think when we did $10 million in the earlier in April, we added 600 units, is that right? 645 additional units. So that's the second part of it. And actually, every unit we can add there helps with that lower end too, because it keeps pressure off of that very low end of the housing. The third part, the sort of workforce housing, people who are working for a living, but it's just too expensive. There are two things, well, I'm not going to come back to transit too much, but I will say that our transit-oriented development districts, which are proposed in the city, will allow us to reinvest revenues tax revenues generated in those districts to keep the cost of living down in those districts where we have transit available, which also reduces one's general cost of living. And so we're going to do these transit-oriented development districts around town that will allow us to focus on that. The final thing that we can do on the workforce side is add density. And that's not always an easy thing to do because sometimes it's going to mean you're changing neighborhoods. But we have a fundamental supply versus demand issue that is driving the cost of housing up. And the easiest way for us to confront that on the front end is to allow additional density in certain areas so that we have more housing, which pushes the cost per unit down generally in our community. Thank you. Jim Schulman, he always has a question, I'm sure, about. You're letting everybody else go before you go.
I am Lieutenant Colonel Martha Schaefer. I work here at Maplewood High School. I'd love the Opportunity Now program. What are your intentions to expand that program, continue the program? And more importantly, how can you work with the local employers to ensure the jobs are located where the students receive transportation to get there?
Transit. So I mean, opportunity is associated with the ability to move around. So I mean, that's why I've been supportive of the transit initiative, because it does, the lack of consistent, inexpensive transit is really an important obstacle to people reaching their full potential. I'm committed to Opportunity Now. We're going to do it again this summer. And we're in the process of going out and building community support to create essentially a foundation, a board to keep it going in perpetuity. There are thousands of young people every summer that are going to get a chance to go do a real meaningful job, in many cases paid, and it is one of those things that could really be transformative across the board. Not just in terms of helping young people see an avenue to success, to a new job, or to a job or a career that maybe they had never thought of, but it will have I think it'll have an impact on the youth violence issue that we talked about as well. I think youth violence is deeply related to a sense of hopelessness, and these Opportunity Now jobs and seeing people who have succeeded and how to do it, and understanding more that people can succeed, is an important part of addressing the youth violence that we have had in our community.
My name is Stephanie Perry, and I lived in Nashville about 26 years. Live over in Edge Hill, which is East Nashville. And when we first came here, we sent our kids to Hattie Cotton, and probably about 6 months later, we had to move them to a private school because the education just wasn't the same level that they were used to. Then, just recently, I looked at the ratings for Nashville schools. On USA Today, they do this regular national, they check all the schools in the country, and Nashville schools, there's two that ranked 97, 98, and the third one is like 39 percentile when it looks at the national ratings. What are the plans? That just seems like it can't just be a poverty issue across the entire city causing this issue. Is there, and since we are so blessed right now with the amount of new people coming into the city, are there some major initiatives to make this change for education, upgrading our?
I share your sentiment about a couple of things. One, the current status of metro schools is one that we need to improve on. I think I said at the beginning that there are good things happening at Pearl-Cohn, because there are kids who are making it out, graduating from Pearl-Cohn and going on to college and doing great things. And I think that's true across the board. The same is true here at Maplewood. It's true at every single high school that we have. It's not true uniformly is the problem, is that we're not doing a good enough job with enough children. And so Dr. Joseph and I have been talking about how we're going to build community support for making programmatic investments in Metro Public School System. The last time we made any significant programmatic changes was, I think, 2003. So in 2002, 2003, we did a comprehensive review of everything we were doing in Metro Public School Systems. It identified in elementary, middle, and high school a whole series of things we needed to do to improve upon the outcomes across the board. So and we made some of those investments, and we saw some early improvements in K through 4, and primarily because those are where we made the early investments. We have not made those same kind of programmatic investments since. We sort of just inched along and done a little bit each year on basically to keep up with inflation, and occasionally finding smaller programs that we can add to the mix. Fundamentally, in order to make those kind of programmatic investments, we'll have to find significantly more revenue to do that. And so Dr. Joseph and I are already talking about how to build community support for that, because more revenue is hard to come by under these circumstances. I know that sounds crazy, but it's true based on how our tax structure works with the reappraisal, and every time there's a reappraisal, you reduce the rate. I'm not, I'm not going to say that. I was going to say I'm not responsible. I don't have any day-to-day control over Metro Public Schools. I don't even like saying that because it sounds like I'm dodging the issue. And I don't like doing that because it is the most important thing we do. So what we got to do is come together as a community and find a way to make those kind of investments and see more significant change in each and every one of our public schools. There are great examples of things that are happening, and I think it's important for us not to be negative about Metro Public Schools, because it becomes this cycle of, well, people won't invest because they feel negatively about it, and we've got to do some things to invest in the schools. I'm working with Dr. Joseph to identify what they are and build community support to do them.
Hi, I'm Joy Stevenson. I
Hello.
am an employee of Nashville General Hospital. I've been there 9 years, and I enjoy working with the community that I do. However, you did mention that you were keeping Nashville General Hospital open. Financially, what are your plans for Nashville General Hospital remaining open so we can serve our patients as needed? What is the budget? What is the budget plans for that? Is it going to be at least $50 million or more, or what are the plans for the budget as far as for our patients are concerned?
Well, I'm going to round the numbers off a little bit because I don't have all of them written down in front of me, but I think, and if I'm wrong, Joe, let me know if I'm wrong about the numbers here, but I think last year we did somewhere around $53 million total, is that right? 54? 52. For this year, this current year is 52. Of that, 8 more or less was accumulated AR, right? Something like that. So in essence, for the current operations last year, it was around $45 million just for the operations of the hospital last year. This year we'll do more than that. It won't be a bigger number this year because the hospital was able to get up on a lot of old bills last year. But in terms of funds available for the operation of the hospital, it'll be more this year than it was last year. Additionally, the hospital had asked for about $500,000 in, I guess, short-term capital needs, 550-something million, more than $500,000. And the council, I think, has already approved that at the last 4% budget. Is that right? So the council has been strong supporters of this as well. So the challenge then, so I mean, I think, well, I believe the council is committed to making sure that they have the resources necessary. The challenge is to make sure that those resources are well deployed and that we're doing the best that we possibly can to provide services to the indigent in our community, health services. There's some things that are beyond the control of the hospital authority that require them to spend money that they probably wouldn't spend if it were entirely up to them. That's because we also have a commitment to Meharry Medical College. So Meharry needs certain things from the hospital, and we've been committed to providing those as well. So we met Monday to try and work through some of those issues and see if we can get better aligned as a community to provide both of those services. And I think we're making progress. And I'm willing to be corrected if I need to be. I think that's right. Don't you, that's where we are.
Hi, good afternoon. My name is Kim Wright, and I'm a single mom, so I actually have two questions.
Okay.
One is, there's an average of 122,000 annually cost for juvenile inmate care. So though you may not have the direct with MNPS, isn't the mayor's office part of the budget that could help out with social discipline and racial disparities in the school? Where is there money to continue adding programs that will help with some of the disparities that are experienced, especially from middle to high schoolers? As well as, and my second question is, with the things that are going on housing-wise, we understand what was in the mayor's report before you came into office, but what are some things that are being done, specifically being done, that are not in that report, because some of those things aren't actually happening, except for the commitment to the Barnes Fund and the other things you mentioned about 15 minutes ago?
Let me see if I can remember. Money in schools budget.
For social discipline
Right.
and racial disparities.
Right. I'm going to have to, maybe I may have to ask somebody else to help me on that. I do know that there has been a long time disparity by race in terms of discipline at Metro Public Schools. It's just, I don't know why, but I think if you look at discipline as it relates to students at Metro Public Schools, we've identified that there is a disparity in terms of punishment, and it relates to race. So my sense is, from talking to Dr. Joseph, that they believe they already have a plan in place, and they're making progress in terms of bringing that disparity down. And so I'll have to follow up with Dr. Joseph more specifically about exactly whether or not he feels like he needs additional resources to make more progress on that program. I've told Dr. Joseph this year's budget is basically going to be a status quo budget, just like it is for everybody else. In some departments actually may see may not actually get as much as they got last year. So that's just a fundamental truth of where the budget is this year, and I think I'm being loud and clear and letting everybody know in advance that that's just where we are this year. In terms of housing and what we're doing there, we are focused on the Barnes Fund. We do intend to. We have $25 million in bond fund that has been made available, and we're moving forward on that. Where we have land that is that the city owns that we're not currently using, and we're working with private developers, not-for-profits, to get housing built on those parcels so that we can continue to meet the need. We're going to push developers every time they ask the city for anything in terms of infrastructure or tax increment financing. We're going to get them to be building more housing that is affordable and attainable to people who live in our community. But I'm going to come back to transit again and say that one of the most critical things we could do for our community in terms of making it more affordable to live here is to go build out a transit system that is affordable, reliable, and available to everybody. And on top of that, build in these transit-oriented development districts, use the tax revenues that are generated there to go in and make sure that we're providing affordability there. Let me tell you a little bit more about the transit system and why it's important. The very first steps of it are adding additional bus service across our county. That's going to happen immediately. You're not going to have to wait for anything to be built. It's just going to happen. Additionally, we're going to go ahead, and for people who are at 100% or less of AMI, that you'll get a free pass to use transit. people who are at 100 to 200% are going to get a discounted pass. So it does all sort of fit together. And I know there are questions about the transit plan. I know not everybody is for it. I know it's divided the community probably more than any of us wanted. But I'm just here to tell you that for the people in this room who want me or the next mayor to be able to do something about transit, about housing, about employment in our community, about the disparity between the haves and the have-nots, the transit initiative is the single biggest opportunity on the horizon, period.
Good evening.
Hey,
I'm
how are you?
Hi, how are you?
Good. A little bit hot up here, but it's okay.
I'm Matthew Bond. I live in Inglewood. And speaking of the haves and have-nots, over the last 15 years, we've seen incredible development and growth and building. And yet, it seems that commercial properties could be paying more in property taxes. And thus, we would have a little more money to work with. There's been a lot of building, towers, small towers for apartments, retail, and so forth. And I'm wondering how we can get commercial property to pay more of the property taxes.
Well, I'm going to say technically we probably can only do that if everybody pays more. So commercial properties are taxed at a higher rate already, but the actual dollars per hundred is the same. So everybody in the urban services district right now is paying $3.15 per $100 of assessed value. Assessed value differs. Assessed value for residents is at 25%. Assessed value for a commercial property is 40%. We can't change that 40% versus 25%. That's state law. The only thing we can do is raise the $3.15. But we got to raise it for everybody. It is historically low. It's lower than it's ever been. And I'll just give you if we had kept, I guess last year the rate went from about $4.60 down to about $3.15. If we had just kept the rate the same, we would add almost $500 million in new revenue to the city's budget. So, that's how it would happen technically. I think there needs to be broad consensus and a lot of conversation before any sort of tax increase is considered, and there's not one on the horizon right now.
Hi, my name is Mary Jo Cram. I live in Inglewood. I'm a Metro teacher. My son's a student at Ross Early Learning Center. I'm mostly concerned about the Metro budget for this year, and I can have a long list of all the programs that are being cut because the schools just don't have enough money. And I'd like to ask you to give Dr. Joseph every dollar he asks for and more, as much more as you can give him so that he doesn't have to make those cuts. He could give more to social emotional learning and his efforts to end the racial disparities in discipline. He could give more to school lunches, early learning centers. I can just go on, but please give him money.
Well, I appreciate that very much. And I think Dr. Joseph knows that, and because I have talked to him many times about the fact that I will give him every cent I possibly can find for him. It is the highest priority for me. I don't know how much it's going to be yet. It's not going to be satisfactory to you, I can tell you. But I'm going to do my absolute best to get him every single penny that I can. I went to Ross Early Learning the same day I went to Pearl Cone because the city is committed to providing high quality pre-K education to every kid in town who needs it, who can't afford it on their own, and because there's a lot of evidence out there that high quality pre-K makes a big difference. There's also evidence that not high quality pre-K doesn't really have the same benefits in the long run. So we're focused on making sure that people know what high quality pre-K is, making sure that we do everything we can to get it into their hands, and where necessary over time, because it's expensive, make it available to everybody who needs it.
Yeah, Dustin Overton, I'm at Cleveland Park.
Okay.
My son goes to Ross Early Learning as well, and I had another son that went there the year prior. There's a school in the East Nashville area, Lockland Design Center, great school. I tried to get my son in there. It turns out that, it's very hard to get in there. You almost have to be in the GPZ to get there. Well, it turns out that there's one African-American child that got in the kindergarten classes that go there, but the way the GPZ is structured, anybody who can go to McKissick or anybody who can go to Warner, if they just go and apply, they can get in this great school. But like if you go to greatschools.org, I think right now it's 83% white, and it's a pretty, African-American, big African-American community. So my question is anything going to be done intentionally to try to get more people of color to get access to great schools like that? If, we can find out that that's an area that isn't getting African-American students, but there's a lot of African-American students there who should, have access to it. And to steal another question, is there God forbid transit doesn't pass, is there something, that y'all have like to get it restarted immediately? Thank you.
Well, I think as I said at the beginning, I think we all, I think even people who are not going to vote for the transit initiative, I think everybody agrees that we got to do something, right? So I'm not going to debate anybody tonight about pros or cons of it, and I hope everybody will vote for it. And without regard to what happens on May 1st, we're going to be working on transit on May 2nd, and because it's a critical, important part of what we have to do as a community in order to be successful and be equitable. That is an important part of it, is that for the middle school mom who works the 7 to 3 shift, and there's a bus that could pick her son up and take him to one school, but he gets into Meg's, and there's no bus that takes him to Meg's. Well, that mom's going to have to make a really brutal choice, right? Right? How am I going to get my son to Meg's, where I know that there's a pathway to one of the top-rated schools in the state, right? Or if I've got a yellow bus that's picking him up and taking him to a school where I'm worried that the pathway is not the same, boy, that is just not a choice. As a community, we should put that mom in the position of having to make. That's why transit's so important, because it will give more and more opportunities for young people to get to that good choice, the right choice for them. And it could be that it's just a particular teacher or principal that the parents fall in love with and want their child to go there. All kinds of reasons that parents are going to choose, if they have the option, the transit option, they're going to choose to pick particular schools. Lockland, I know a fair amount about. And when Lockland opened, it was, I think, it was probably 50-50. It's probably 50% African American, 50% white. And so, you didn't have to live in the GPZ. And I guess 11 years ago or 12 years ago when it opened, you didn't have to. You could live basically anywhere in the Stratford cluster in the first couple of years and get in. East Nashville's been gentrified in that following decade. I mean, I think that would be a fair statement. And so it has, it's changed the racial makeup of the community. So I can't really tell you how to fix that. It's hard, right? There's not a single answer to that. But I can tell you what made Lockland work at the beginning, because I helped get it started, as a matter of fact. What made it work at the beginning was that parents believed that the school board was listening to them and that they had a voice in where the school was going. And the director of schools at that moment actually brought a group of parents together and let them vote, essentially, on who would be the principal of the school. He'd narrowed it down, but he said, you guys pick. Pick which one you want. And so I think that's a significant part of how you can organically build more and more high-quality elementary and middle and high schools in our town. So, and I think that takes Jim Schulman or Council Lady Hart or Council Lady Van Rees to sort of pick up the banner and say, I'm going to change this school. That's how it happens. It happens when somebody from the community says, hey, this is an opportunity and I'm going to lead here. So I challenge you, sir, to be the leader that changes the next middle school or elementary school in our town, because that's what it takes, is somebody to stand up and say, I'm going to do it. This must be the last question because Councilman Schulman thinks he can ask one. Go ahead. I'm joking.
Well, she has
okay, go
I'll
ahead.
let her ask the question.
Okay, go ahead.
And then I'll ask mine.
Thanks. Since you dropped the gentrification bomb, I'd like to pick up on that. My name's Amy Shalide Mayer. I live in this neighborhood. I work at Catholic Charities. I'm also on the Welcome Home campaign, and I appreciate the steps that you've mentioned the Metro government has taken for affordable housing, and I'm excited about transit, how it will help the environment. But what I'm worried about when we look at other cities that have expanded in such way with light rail, gentrification explodes. And I live in this area. I grew up on the west side. I've been in Nashville my whole life, and I'm concerned about seeing the culture change and the poor being pushed out. So I'd just like to hear specific steps that you have in place to prevent gentrification from only getting worse because of the transit plan.
Well, I'll answer your question, but I'm going to preface it with the answer of I won't really have any tools if it doesn't pass. I'm not going to get any new tools if it fails. I'm not going to have the ability to make transportation reliable and affordable. I'm not going to have that opportunity. The transit-oriented development districts are probably not going to happen because we're not going to have the same level of transit. One of the things about the transit initiative is that it creates a permanent, reliable source of revenue to work on transit. If we don't have that, any transit improvements are going to have to come from the general fund of the budget. They're going to have to come from monies we already have. So when MTA asks for $5 million in next year or the year after to maintain the current level of service that we have, that's going to have to come from funds that otherwise could go towards affordable housing or workforce development or promoting better public education in our town. So without transit, I can tell you where we're headed. Without the transit initiative, I can tell you where we're headed. With it, we will have new tools. We will have the ability to go out and do transit-oriented development districts where we can reinvest the new tax revenues in providing affordable housing. We will have thousands of new jobs where we can work with people who live in our community and make sure that they have a job that pays enough for them to live in a house of their choosing in the neighborhood where they've lived their entire lives. So it is a stark decision between one or the other, in my opinion. So, having said that, I've met with Welcome Home, and I am sensitive to the fact that we need to find a permanent, dedicated source of revenue to do more, especially on that 0 to 60% end of the scale, to provide housing available to the people who are in that income spectrum. Additionally, I I think we need to do more on the 60 to 120 area, and we will do everything we can to find more revenue over time to spend in that area. So I get the concern. I share the concern about Nashville changing, but none of the 1 million people who are anticipated to come here in the coming decades are listening to our conversation right now, right? They're coming. And with all due respect, the gentrification that took place in Lockland Springs and in Edgefield and every neighborhood in East Nashville over the last decades happened without transit. I don't get the equation. I don't get the correlation between transit and gentrification because we already got it. I mean, we already have it.
So, Mr. Mayor, I get the last question.
No, we have one more here.
Oh.
No. No. At least I probably made somebody mad with that one. So.
Okay, well, I've got two questions then.
Okay.
Okay, here's the first one. The first one is, what is your prediction on the Preds against the Avalanche series?
Okay, it's number one.
That's number one. And number two is, as a member of the council, and when you served as vice mayor of the city, you pushed transparency. That was one of the major things that you went after. It's one of the things you talked about when you ran for office, and it's one of the things that you pushed us as the vice mayor. So town hall meetings are wonderful. So I guess my question is, how do you keep this up? How do you keep listening to people and hearing the concerns from teachers and people who are concerned about their neighborhoods and everything else? What's your plan to keep listening to the folks out in the public?
Well, we'll keep doing these for one thing. We'll probably switch the format every once in a while and make it a little bit less of a stadium and more relaxed. We will continue to do the surveys, so we can, from a more systematic, objective basis, find out what people are thinking. I met today with a lady who had come to see me about a particular issue, and she said that in 1975, when she first moved to Nashville, that Mayor Fulton, then Richard Fulton, had been elected, and he, for the first 20 days in office, basically had office hours. And he said, okay, come talk to me. And it was interesting, she said that at that point in time, for those of you who weren't around, whatever that is, 40-something years ago, our jail, and it was not keeping people healthy, much less dealing with their mental health issues. And so she just walked in and said, hey, I'm a nurse, I can help make that better. And he essentially hired her on the spot to get in there and start making changes. So that sort of spurred me to think that I probably need to figure out some way so people can just talk to me, and in a really informal setting. I don't know exactly how that is going to work, and it's probably going to have to be in June or July before anything like that could happen, because we've got a lot of stuff to do just from a logistical standpoint between now and then. And I am routinely wrong in terms of predictions. I am more wrong than right. So if I wanted to accurately predict the game, I would predict that we were going to lose, right? But since I'm not willing to do that, I'm going to decline to make a prediction. For those of you who followed that, I've got an SAT test for you later. Sir, did you have one? Or I'm sorry, whoever's got it is fine.
Hi, my question is, since we're going to raise taxes anyway with the transit, why not take that money and put it into the schools and improve the current bus system, add to the Music City Star, because most of the traffic that's coming is coming from out of the cities, coming into Nashville to work. Is there any way that you could use that money or raise taxes for that, since there's going to be an increase anyway?
The specific proposal that's before the people on May 1st is governed by a law called the Improve Act at the state. And the Improve Act only allows us to use those monies for transit. So we can't, the money that's going to be, would be raised by the adoption of this referendum can't be used on anything but transit. So, but you're fundamentally right in the sense that if we don't have this source of revenue for transit, we're going to have to find some other source for transit, and that's going to make it more difficult for us to fund public education. Now, one thing that we gotta start changing our thinking about in Nashville a little bit is that we do have a lot of commuters coming out into Nashville, but we are starting to send a lot of people out as well. So there are a lot of commuters going from Nashville to Brentwood every day to work. And there are more and more commuters going from Nashville to Rutherford County. So it's becoming much less of a people only coming in. We certainly have a lot of people coming into Nashville, but we have people going out as well. One of the reasons that the current tax structure is included in the transit proposal is because 47% of the sales tax collected in Davidson County is actually paid by commuters and tourists. So it was the closest we could get to a commuter tax. So.
Good evening, Mr. Mayor.
Hello.
Oh, we got two at once. You go. Go ahead, sir.
Well, good evening, Mr. Mayor. First of all, I want to thank you for your support at Nashville General Hospital. We are very proud to have you on to supporting us in the way that you do. One of the questions that I want to ask you is that there are several groups that have been put together to come in and kind of critique General Hospital and kind of report back as to what they see. And one of the main groups that has come in is the council committee. They have been wonderful. They have come in and actually looked us in the eye and really talked to us and walked with us and talked with us on how best to serve the community. Whereas I must say that there are some groups, I don't mean to be disrespectful, but in some groups I feel that they are not coming in and actually talking to us face to face. They're more or less looking at us through a telescope, and that's not fair. And also, I don't mean to embarrass my CEO, but I kind of just want to ask you your opinion as far as that continuity is very important, and especially at General Hospital. Dr. Webb has done a phenomenal job there, and we want to know how much weight do you hold, even though you are the mayor, in the decision to make sure that he's there to see through what he has started, because he's done a phenomenal job with Nashville General. Thank you.
Well, let me take those in first and second. In terms of all of the different groups that are out there looking at the hospital and how to make it function well, I share your concern that there are too many of them. I think I might be. I think we might. I see a nod, so we're agreeing on that. That's what Dr. Webb and I talked about this Monday, was trying to figure out a way to sort of get everything more aligned. And I'm not asking the council to stop doing their work, but I think we all got to sort of put our heads together and figure out what the best way to align is on the hospital. I have encouraged the hospital board to resolve the other issue that you're talking about. I mean, I've encouraged them to do that. But that's their decision. I can't really. I think, and Joe and I have talked about that too. Yes, sir.
Hello, Mayor Briley. This has kind of been touched on in some of the other questions, but I don't know. Does the city have any role in providing mental health services in the city? I mean, the schools proposed cutting social workers. We talked about the homeless, General Hospital. I mean, so many of those. I think you mentioned the jail is going to have a ward or whatever, cells for that. But is there a role that the city plays, or is that totally a state function? And then I have a second question, just like Jim.
Oh, two questions. I think, all right. The first question I could probably talk for 10 minutes on. but I won't, because they're nodding. No, don't do that, don't do that. The jail, currently the jail is called, we're calling it, it could be as high as 40% of the people incarcerated there have either a mental health or a substance abuse issue. And we pay for the jail. Citizens of Davidson County, we pay for it. So yeah, we got a big role. And fortunately, we're we're pretty far down the road in terms of building a new sheriff's facility downtown. It's got a detention side, and it has got a side that is going to be behavioral health. It's got, which is not going to be, it's not going to put somebody into a cell when they walk in, because we know that that's really just, it just creates a big cycle. It's just the same thing over and over again. A lot of the individuals who are in jail right now with a mental health issue are there because the last time they were there, they were told to do something everybody knew they couldn't do. They were told you're going to be on probation and you're going to do A, B, C, and D. Well, anybody with any sense would have known the minute that they were told to do that, they would never be able to do it. So to his credit, Sheriff Hall is working on trying to do some stuff to address that. Additionally, I guess within a couple of days of being sworn in, I went to the opening of a new facility at the run by the mental health co-op. It's the result of some work that was done under the Berry administration to bring people together from across disciplines, across departments, and identify things that through collaboration you could do a better job with. And it's a facility where people will be able to go in lieu of going to jail to try and get them the kind of care they need to deal with their mental health issues. One of the things so yes, we have a role. The state has a bigger role. They could expand Medicaid, and boy, we'd be doing much better. That would be like a woof. Okay, that would be quite helpful. But for some reason, they're intent on not doing that. But the expansion of Medicaid would give us all kinds of additional resources to focus on mental health care in our community. Mental health care, it also relates very much to substance abuse. And we have an opiate crisis in our town right now. The fire department, in their budget hearing, one of the line items for increase is for Narcan. That's because every week they administer 100 doses of Narcan in our town. And so I thought that was 1.4 an hour. That was the way I did the calculation. It's probably a little bit less than that because you're sometimes administering 2 and sometimes 3 doses just to get somebody back. But we have like a real crisis on that front. One employer told me that half of the people they send for a drug test fail it for opiates right now, half of them. So there's like a real problem with that. So there are things we can do on that front as well. In your second question?
This is my transit-related question,
All right.
But it's transit that goes around in a circle, and I've asked a lot of your predecessors, when is the carousel going to be taken out of storage?
No comment. I don't know the answer to that question. I will just say that Don Schreiber was a longtime friend of mine, and he cared passionately about that. And although he's no longer with us, I will do my best to help in that regard.
Hi, Ben Burton, North Englewood. You've touched on this a couple times, and it's something that really frustrates me. You say the state won't let us, and so there's been some initiatives that Nashville has tried to move forward with, marijuana decriminalization, the Airbnb limitation in neighborhoods, and those are things that the state has struck down. So I just want to know your thoughts on state interference with Nashville matters, internal matters.
It's a reality, right? We can't ignore it. And it's not likely to change because we flaunt our blueness in opposition to the redness, and that's not going to work, I don't think. I think we've got to be prudent about it. I think we have to do a better job of communicating with people who are in the state legislature. So my first week in office, I went and walked through the Senate and through the House to try and put a face on what I was going to be saying so that people were not immediately hostile to me. If you look at economic growth in our region, in our state, it's all happening right here, right? So we are interwoven in terms of our success as a state, whether we like it or not. So I guess I'm optimistic that over time that animosity will dissipate some, and we'll be able to do more as a city than we are now. I know that's a completely and totally unsatisfactory answer, but the reality of it is that we're going to have to sort of slog our way through that for a little while.
Buenas tardes. ¿Cómo está, señor? Gracias por estar aquí.
¿A usted?
Thank you for being here. My question is about transit, and I'm kind of worried about that. If is this the right choice and the most effective way of transit, because it will take 14-year period to build the transit, right? Fancy transit. And so what I'm concerned is that if we have to deal with even more traffic because of the construction. That's my question.
Okay, thank you. So just to reiterate, the early part of the transit initiative would result in expansion of bus routes primarily, no construction needed. So at the very beginning, for the first few years, what you're primarily going to see is longer hours. So buses would run for 20 hours, Monday through Saturday, 16 hours a day on Sunday. Additionally, there would be more frequent. And so initially, the upside is all going to be on buses, and that's not going to have a big impact on construction in certain areas. As we do build out the fixed rails along certain corridors, we are definitely, there will definitely be some interruption, but it's not going to be, we're going to be very thoughtful about it. We're going to phase it. We're going to make sure that businesses along the corridors are accommodated as we do it, so that the impact on them is not too great. I believe this is a good plan. A lot of people have talked about it. A lot of people have had input in it. It's backed up by evidence from what's happened in other cities, and I think it's the right thing for our city to do. So I know people have questions. It's fair to have questions, but I do believe, in my opinion, it's the right thing for us to do right now.
My name is Lori Stovall. I'm from Goodlettsville. And I came to say thank you to Metro for a program that you offer. It's called Metro Parks Disabilities Program, and it is a program run for adults in our community that they meet 4 days a week at Sportsplex, and they let them go into the communities. They give them a safe place to go. My son is a member of that program. So I just wanted to say thank you, because as a working mom, it gives him a safe place to go that I don't have to worry about. And my only request would be that maybe we offer it 5 days a week instead of 4, because I have to find 1 day a week. I have to go somewhere and find him a place to go. And that also they would have more staff, because there's 70 people in this program, but they have a huge waiting list for more people. They service everybody from about 23 years old to, they have one gentleman that is 72 years old. But he's young at heart. But that would be my only request, is that they would have a little bit more services. But it is an awesome program, and I thank you for that.
Well, thank you. One of the things I have learned in my 40 whatever days acting as mayor is that there is very little. Well, every single day I'm surprised by something new and good I learn about what the city is doing, either in government or out. And I don't know, maybe it's the national mood or whatever, but we seem to focus a little bit on all the bad stuff that's going on. Nashville is in a great spot right now, in virtually every respect. Many cities across the country are dealing with an affordable housing crisis, and they're seeing their economy decline at the same time. Many cities no other city in our country has as low an unemployment rate as we do. So there are so many good things going on. I think I really do appreciate your coming and saying that the city is doing something right, because there is so much that every department is doing to make this a better place to live. And it's not the city I grew up in, that's for sure, but 90% of the change has been for the better. I mean, it is, for those of you who did not grow up here, to think back at some of the things that we lacked that we have today. I mean, you ought to sit down and talk to somebody who's been here for 50 years or 60 years and hear how much this place has changed for the better during that time. And we are on that trajectory to keep making those positive changes. Yes.
Yes. Just first want to say good evening to you, Mayor Bradley. Good to see you.
Good to see you too.
All right. And so a few things. One, I think I want to just ask, my chief concern is with transit. And so I'm looking at the proposed plan, and I see that where the rail is going, and where I think the rail is going, but it appears to me that the rail is not going out through the northwest or up toward Clarksville. Or is there and the reason I ask that, because I have family and friends that presently commute by car back down for jobs, and then I go to church in that area, and I know that there are a lot of people even up as far as Hopkinsville, Kentucky. If that rail went that far, I think it would all, and I understand this is all going to take some while, but I guess the main part of my question is there a plan to, at some point, push rail through that corridor as well?
Well, there's an existing rail line that runs all the way from Nashville to Clarksville, where we hopefully, if Clarksville and Montgomery County want to participate, ultimately we can build commuter rail out through that corridor. One of the fundamental things you have to understand about transit is density, and for it to work, it has to be surrounded by density. And so as you go to the northwest quadrant of Davidson County, that's the least dense. You go through Bells Bend, which is 20,000 acres and has, 100 people living there. I don't know the exact numbers, but it's very low. So the worst possible thing the city could do would be to build a fixed rail system in some part of town where nobody is there to use it. Because then, boy, I can hear the complaints. You're running those trains and nobody's riding them. So we got to be focused on putting it into areas where density exists. That's why the Gallatin Road Corridor is the first one that's being considered, because you already have riders there, there is density there, there's the ability to add more density there, and it's likely to work along that corridor.
Next thing I wanted to say was just kind of thank you. I serve as the president of the Parent Advisory Council for the district, so I want to thank you for your efforts and your help toward trying to move that budget along. I know it's tough, but I just want to say I appreciate your efforts.
Thank you, sir. I think we've got room for one more question. Yes, ma'am.
Hi, I'm Rachel Burton. I live in North Inglewood.
Hey.
I don't have questions. I have a couple statements. If we're so aware of all the issues in our community surrounding violence and opioid problems, we know that we have to have social workers in the schools. Second statement, thank you for listening. Third, Preds will win by 2 goals tomorrow night.
She will have the last word. Thanks to everybody who came out. I really do appreciate it. And if you have anything else you didn't feel comfortable saying here today, but you want to share it with me, just email mayor, M-A-Y-O-R, @nashville.gov. Or I'm not going to be able to stay, unfortunately. I do need to sneak out and go pick up my son. But we'll have more of these and come back next time. I think there's a schedule already, right? All right, thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.